The One Big Beautiful Bill Act that President Trump signed into law in July is new funding for rural health care.
It's called the Rural Health Transformation Program, and it's a $50 billion one-time funding program aimed at improving health care access in rural communities. But will it move the needle on transforming health care? Our Washington correspondent Rachel Knapp is live in D.C. tonight. Rachel, you spoke with health policy experts. What are they saying about it?
Good evening, Nick and Renata. So rural healthcare systems already face a lot of challenges, from staffing shortages to hospitals not getting paid enough. Now, this program is one of the largest investments in rural healthcare, but with the estimated cuts to Medicaid from the One Big Beautiful Bill, experts that I spoke with say this funding might not be enough. The Rural Health Transformation Program is a new $50 billion funding program created from the One Big Beautiful Bill Act. Half of that money will be distributed equally among all 50 states. And for the other half, the Centers for Medicare and Medicaid Services will have broad discretion over distributing the money after states apply for it.
This program's major focus is to deal with the folks who are most vulnerable in rural America, because for them, having insurance isn't the big challenge usually. It's getting access to care.
Experts estimate the One Big Beautiful Bill will reduce federal Medicaid spending in rural areas by $155 billion in the next 10 years. The reduction will not only have an impact on Medicaid beneficiaries, but these changes could negatively impact rural hospitals and rural healthcare consumers. This new program is supposed to act like a safety net, but health policy experts say it will fall short in the long run.
It's an important investment to do innovation, infrastructure development, workforce investments, but there is concerns that $50 billion won't be enough to offset what are the anticipated losses to payments in rural communities.
Already had a rural health system that was challenged, and then you put $150 billion cuts on top of that system. That's going to make those challenges even more acute. I've already started to see some hospitals and clinics close around the United States. The main thing about the big bill is it's expected to lead to many people dropping Medicaid coverage. Just to put this in context, there are many rural hospitals and systems that rely more than 50%. I've seen numbers as much as 60 to 70% reliance on Medicare and Medicaid.
Nick and Renata, another big concern about this program is that it's just a one-time funding deal. It's not reoccurring. Dr. Mehmet Oz, who's the CMS administrator, was asked about that. He said that's the purpose of this program, is that it's big, but it's also limited. He says that, quote, "We don't want to create a new pathway for people to get money sent to the systems that are not viable as they are," end quote. He also adds that this program hopes to train enough people and make some of these healthcare systems independent from them in the marketplace, so that these healthcare systems in the rural settings are viable and fluid. Back to you.